Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith Rogers. Today, the connection between alcohol and gun violence. I talk with Sylvia Villarreal and Josh Horwitz of the Johns Hopkins Center for Gun Violence Solutions about a new report that looks at alcohol as a major risk factor for gun violence. We discuss their policy recommendations, as well as ways that individuals can consider their own safety when it comes to alcohol and guns. Let's listen. Sylvia Villarreal and Josh Horwitz, thank you so much for coming on Public Health on Call today.
Thanks for having me.
Thank you, Lindsay, for having us and for this great opportunity to share our work.
So today we're going to talk about a report that came out from the Johns Hopkins Center for Gun Violence Solutions and the Consortium for Risk-Based Firearm Policy about this intersection of alcohol and firearms. So I want to start out by asking you, Josh, to tell us about a risk-based approach to reducing gun violence. Let's start with the broader concept here.
Thanks for asking that. It's a great question. I've been working in this field for a long time, and there's been, and rightly so, a sort of focus on some of the hardware around firearms. But I don't know that there's been enough attention been paid on who has access to firearms. And so that's something, about 10 years ago, I started looking at after the shootings at Sandy Hook. How is it that people legally acquire firearms who seem to be dangerous? And so I realized that the sort of laws that we live by under the federal laws and many state laws were not really tuned to addressing real threats of harm to self or others. And so a risk-based approach is when you think about what risk factors there are for harm to self, harm to others, and you identify those risk factors, you try to quantify them the best you can, and then you try to incorporate them into equitable policy.
And so what caused you to approach alcohol as a risk factor here?
We've written a number of reports. Our first report from this consortium was about the Extreme Risk Protection Order and looking at why we need these laws, which are often referred to as red flag laws. And we realize that there's oftentimes not one risk factor, but a multiplicity of factors, multifactorial, that go into identifying people who are at risk of violence. One of those factors that came up over and over again was alcohol. And as we looked at the literature, there's a lot of general literature on alcohol, but not specifically tuned to its interaction with gun violence. And we thought after doing a number of reports and this issue coming up over and over again, it was time to really take it head on and identify it as a risk factor. The other part of that is that it's an unknown risk factor. We talk about gun violence all the time, and you hear about mental illness, for instance, which is a really small contributor to interpersonal violence. Alcohol is a much bigger contributor, but somehow after a shooting, no one talks about it. And so we really wanted to take the veil off, if you will, and say, alcohol is a risk factor that must be considered.
I want to get into some of the actual numbers around that, but first, I think we should talk about, when we're saying that alcohol is a risk factor, it would be helpful to know what the actual policy details are that you're talking about, because there's sort of two main recommendations. And so, Sylvia, I'm going to ask you to give us an overview so that we really understand how alcohol and gun violence are connected.
So based on the research evidence from public health experts and the studies that we used in our report from Gehring and Wintemute and our colleagues at UC Davis, we made a legal analysis of existing state-level laws that intersect on firearms and alcohol and made two broad policy recommendations. The first one is limiting access to firearms by persons with a record of alcohol misuse. And our second main policy is limiting access to guns when, but also where alcohol is consumed. And for each of these two policies, we did also racial equity impact assessments, or REIAs, as we call them. And that's a tool that we designed for assessing racial equity and potential unintended consequences that we use in all our policy recommendations.
And just to talk a little bit more about the racial equity, in the report, you mentioned something called the alcohol harm paradox. Can you explain that?
Of course. So I'm really glad you asked about it. This paradox was really important to frame the disproportionate impacts that are related to guns and alcohol. So we found that the burden on the harms of alcohol consumption was not distributed equally, and that they disproportionately affect people of color and their communities. And the alcohol harm paradox basically helps to explain that while groups that have been historically marginalized consume less alcohol, they nonetheless experience more alcohol-related problems. And just to give you an example, we know that Black and Latino men are more likely to report dependence symptoms and also negative social consequences of drinking, even when the rates of alcohol dependence and abuse are roughly the same, or sometimes even greater among white men. So this paradox is the same for gun violence. So we also know that Black and Latino people are disproportionately impacted by gun violence. And it's those same structural factors that lead to the alcohol harm paradox also contribute to this paradox in gun violence victimization as well.
I want to go back to, Josh, what you said about alcohol as kind of a hidden risk factor. So with these two policies in mind, so one is restricting access to firearms for people who have like a history of alcohol misuse. And the other side of it is actually restricting the presence of firearms in places where alcohol is being consumed. Can you talk a little bit about what you all found in the research about, this hidden risk factor and how it's a predictor of violence, or what is the connection here between those things?
Yeah, another great question. So what we learned with this is that an estimated 1 in 3 gun homicide perpetrators drank heavily before murdering their victims. 30% of gun homicide victims drank heavily before being killed. And a quarter of gun suicide victims were heavily drinking before they died in suicide. So that means that alcohol is the largest risk factor in homicide and suicide. Think about the public debate that we have about firearms, and you're thinking about, after any shooting, how did this person have the firearm? What's wrong with them? What are the things going on? Alcohol is a big risk factor. And then you think about other risk factors like history of domestic violence. And you think about multifactorial situations. Well, history of domestic violence, history of alcohol abuse, these things, these are the things that really elevate people's risk. And that's why we want to do something about alcohol. And this is not when we talk about this is not saying, this is not saying a public attack on alcohol per se. This is understanding the risks of alcohol and violence. And so the pieces that we're targeting here in our solutions are not saying, oh, don't go have a beer or something like that. What we're saying is where we see, number one, a documented history of abuse. That's one thing. And number two, where you're going to see a lot of alcohol consumption, don't mix that with firearms. I mean, it's a very basic rule of firearm safety, but this day and age, it's surprising how much those two things mix. And so if you have a history of abuse, or you're going to have a situation where there's clearly going to be a mix there. That's what we want to address. There's some other societal level factors here as well, right? And I'm sure Sylvia can jump into that about, where alcohol is sold, when it is sold.
Sylvia?
Yes, happy to jump into that. So also, in addition to our policy recommendations and also recognizing the fact that firearm policy does not work in a vacuum, we also made additional policy considerations that are related to the environment where alcohol is sold and consumed. So we found strong research evidence about alcohol density and limiting the days and hours of sale, and about increasing alcohol taxes that also work to reduce these risks that are related to the environment.
So if you reduce the number of liquor stores within a given area, whether that's through zoning or, other legislative means, that can have an impact on gun violence. Is that what you're saying?
Yes, exactly. So there's a lot of research evidence about how alcohol density has an impact on gun violence and violent crime as well.
Let's also talk about, maybe you can give some examples, Sylvia, of states and jurisdictions that have some good policies in place or ones that you've seen that have been successful.
Yes. So what we found in our legal analysis is that some states already have some of these policy recommendations. And our project team did a very extensive legal analysis to understand the landscape of the existing laws and how our recommendations would fit into that context. And first of all, we found that alcohol-related firearm laws vary widely among states. And these laws are also very wide in terms of scope. So some of them are about firearm purchasing, possession, carrying. Some of them are only about the permit and license to carry disqualifications. Some of them are about carrying prohibitions where alcohol is served. And some of them are about prohibitions for seller of firearms. What we found in general is that for the same reason that they are so different in each state, they become hard to enforce. So some states have one DUI, some states have none, some include very ambiguous or stigmatizing language. So we wanted to provide a standard that was backed by evidence and that could help some of these gaps. When you asked about particular states, we couldn't find a state that had everything. So it's hard to just do a recommendation because it's so wide and the scope is so wide. But that's why we did this two main broad policy recommendations.
And why, Sylvia, is this done state by state? Why isn't there some federal recommendation?
I think that Josh, as a lawyer, can help you answer that question with more expertise than I can, but we did find that federal law does not directly address the risks at the intersection of firearms and alcohol, but it does prohibit people that are convicted in any court of a crime that is punishable by imprisonment for a term that exceeds 1 year from purchasing or possessing firearms. So this is what they call the felon in possession prohibition. And it includes state misdemeanor offenses that also are punishable by a term of imprisonment of 2 years or more. So some states have different thresholds to trigger this felon in possession prohibition.
So we have this report, we have these recommendations, and to kind of bring this all home, I'd like to ask each of you, and we'll start with you, Josh, what do you hope to see happen next?
I just hope, number one, that this raises awareness. I think, as a gun violence prevention movement, we just have not talked about alcohol. The press doesn't talk about alcohol. Even some, across the board, we need to recognize this as one of the biggest risk factors out there for gun violence. We're just looking at some of the numbers. 48,000 people died by gun violence in 2021. If you want to make a dent in that, you have to deal with the issue of alcohol. This has to be, central to the core of a gun violence prevention strategy. Not all of it, of course, but when you think about things like background checks, which you've been fighting for years, you want background checks, but you also want them to be checking the system to check things where there are actually risk factors for gun violence. So when you think about a universal background check, or you think about licensing the purchase of firearms, what are you looking for? You're looking for those risk-based factors, and alcohol must be in that discussion.
And Sylvia?
Well, we hope this report was as eye-opening for people as it was for us. We hope it opens up the conversation among public health research to study more this dangerous intersection. We also hope that policymakers can better understand why alcohol misuse is such an important risk factor for gun violence, as Josh just said, and become more interested in addressing these gaps with our policy recommendations. And for everyday Americans, we hope that they can begin to recognize all these risks that are associated with alcohol misuse and guns, so they can push for legislation that can keep our community safe, but also that they're aware of the risks of being in a place where alcohol is served and guns are present.
And Josh, did you want to add something?
I would add that this is really, every individual can start thinking about what risk do they want to put themselves and their families in. And now knowing for me clearly the risk of alcohol and firearms, I'm certainly going to steer away from events and things where those two things may mix. And, being out late at night sometimes is a problem, right? In places where alcohol is served. And so I hope this report just educates everybody about where the risks are and what they can do to avoid those risks.
Well, I think this has certainly been an eye-opening conversation, and I want to thank both of you for your time and know that we will continue to follow this and to enhance your research however we can. So thank you.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.